Welcome to your Health Facts podcast. Today we're going to be talking about men's sexual and urological health. It's a topic that um, a lot of guys have questions about, but maybe don't always feel comfortable discussing.
Well, let's start with psychogenic erectile dysfunction. This is where psychological factors, things like stress, anxiety, relationship issues, play a role in difficulty achieving or maintaining an erection. Now, it's important to remember that occasional erectile difficulties are normal and can occur at any age. But if these issues persist, then it's really important to consult with a healthcare professional just to rule out any underlying medical conditions. Studies show that a significant percentage of men under 40 who experience erectile dysfunction actually have an underlying medical cause. So seeking professional evaluation is really important.
Okay, so if you're dealing with psychogenic erectile dysfunction, it sounds like taking kind of a multifaceted approach is important, one that addresses both the psychological and physical aspects of it.
Absolutely. Open and honest communication with your partner is absolutely paramount. It's so important to foster a supportive and understanding environment. And by shifting the focus away from just penetration to intimacy and exploring different ways to experience pleasure together, you can help alleviate that performance anxiety and create a more relaxed and enjoyable sexual experience.
That makes a lot of sense. So besides communication, are there other things that can help?
Yeah, for sure. Engaging the expertise of psychologists or sex therapists who specialize in erectile dysfunction can be really invaluable. They can equip you with tools and strategies to address the psychological roots of the issue. They can help you to identify and manage stress, develop coping mechanisms for anxiety, and even improve those communication skills within their relationship.
Those are all great points. Now, another question that comes up a lot surrounding men's sexual health has to do with penis size, um, and particularly in the context of the adult film industry.
Right. And it's crucial to recognize that the adult film industry presents a highly curated and often unrealistic portrayal of sexuality.
Yeah, that makes sense.
Actors are frequently selected for specific physical attributes, including, penis size. Camera angles and visual techniques are often employed to create the illusion of larger size.
Okay, so it's not always what it seems.
Exactly. And while some actors may utilize penile enhancements like fillers to enhance girth or traction devices for length,
Yeah.
it's important to remember that these practices do not reflect the reality of most men's experiences.
Right. It's easy to compare yourself to those portrayals, and it can lead to unnecessary anxiety and body image concerns.
For sure.
So shifting gears a little bit, let's talk about urological health. A split or deviated urine stream is a common concern, and I know it can be caused by a number of factors.
Yeah, think of it like a garden hose. If there's a blockage, the water stream is disrupted and may split or spray in different
That's a
directions.
good analogy.
Well, an enlarged prostate, also known as benign prostatic hyperplasia or BPH, is one of the more frequent contributors to a split urine stream. As the prostate gland grows, it can actually compress the urethra, which obstructs the flow of urine. Urethral narrowing or strictures can also impede urine flow, which results in a split or deviated stream. And then there's also residual semen after ejaculation, which can temporarily affect the urine stream as well.
So what should someone do if they're experiencing a split urine stream?
Well, if it's a consistent issue, it's always advisable to consult a urologist just to determine the underlying cause and explore the appropriate treatment options.
What does that usually involve?
Well, your urologist will conduct a physical examination and may recommend additional tests like a urine flow study or a cystoscopy. This will help to assess the severity of the blockage and identify any underlying conditions.
Okay, so it's important to get it checked out. Are there any things you can do in the meantime?
Well, while seeking professional medical advice is crucial for addressing a split urine stream, there are some simple measures that can provide temporary relief. Like sitting while urinating can reduce pressure on the urethra and facilitate a smoother flow.
That makes sense.
But it's really important to note that this is not a solution, it's just a temporary management technique.
Okay, so seeing a urologist is key. Now let's talk more about those penile enhancements because I know it's a subject that generates a lot of curiosity and it does raise important considerations.
Right. The adult film industry may showcase certain techniques and enhancements that create an illusion of larger size, but it's absolutely crucial to approach this topic with a balanced perspective.
I agree. So what are some of the reasons why someone might consider penile enhancements?
Well, some individuals seek out penile enhancement procedures to address personal insecurities or enhance their sexual experiences, but it's essential to have realistic expectations and understand the potential limitations and risks involved before pursuing any of these interventions.
That's a really important point. So before making any decisions, what should people keep in mind?
Well, the pursuit of penile enhancements should never compromise overall health and well-being. Making informed decisions based on sound medical advice and a thorough understanding of the potential consequences is paramount.
Absolutely. So let's break down some of the common methods used for penile enhancement. I know there are both surgical and non-surgical options available.
Right. Each method comes with its own set of benefits, drawbacks, and potential risks. Fillers, which are a non-surgical option, involve injecting dermal fillers into the penis to increase girth. They can provide noticeable results, but they're temporary and require repeat treatments to maintain the desired size.
And what about those traction devices I've heard about?
Yeah. Traction devices are another non-surgical method, and they aim to increase penis length. They work by applying gentle traction to the penis over extended periods, which promotes tissue growth. Now, while some studies suggest that traction devices can yield modest length gains, the results vary widely, and consistency is key for optimal outcomes.
Okay, so they require commitment. What about the surgical options?
Surgical procedures for penile enhancement are typically reserved for cases where non-surgical options have been ineffective or when there's a medical need for intervention. Penile implants, or prostheses, involve surgically implanting devices into the penis to achieve erections.
I see. So they're kind of a last resort.
In a way, yeah.
Can you tell me more about those implants?
Sure. These implants can be either semi-rigid or inflatable, offering varying degrees of rigidity and control. And while they're effective in providing erections, they do involve surgical risks and potential complications.
So it's not a decision to be taken lightly.
Absolutely not. It's a big decision.
So if someone's considering penile enhancement, what's the best course of action?
It's crucial to really understand the complexities of penile enhancements before making any decisions. Consulting with a urologist or a men's health specialist can provide personalized information and help you weigh those potential benefits and risks associated with each option.
That's great advice. So before we wrap up this part of our discussion on penile enhancements, are there any final thoughts you'd like to share?
Yeah, I think it's really important to approach the topic of penile enhancements with a balanced perspective. While some individuals seek these procedures to address personal insecurities or enhance their sexual experiences, it's essential to have realistic expectations and understand the potential limitations and risks involved.
I think that's a great point to end on. We'll be back in the next part of our deep dive to discuss this further.
And, we should also mention medications like sildenafil, tadalafil, or vardenafil. These are commonly prescribed for erectile dysfunction, but they're also sometimes used in the adult film industry to prolong erections.
That's interesting.
Yeah, and it's really important to emphasize that these medications should only be used under the supervision of a healthcare provider, because misuse can lead to some adverse effects and even some health complications.
Right, safety first.
Always, yeah. And another method sometimes employed in the adult film industry is intracavernosal injections.
Okay, and what are those?
Well, it's a procedure that involves injecting medication directly into the penis to induce an erection. But again, this procedure should only be administered by a qualified medical professional, and it's typically reserved for, specific medical conditions.
So not something to try at home.
Definitely not.
No.
Right.
So we've talked about fillers, traction devices, and injections. Are there any other options for penile enhancement?
Yeah, for men with severe erectile dysfunction who haven't responded to other treatments, inflatable penile prostheses can be an alternative.
Can you tell me more about those?
Sure, they're effective in providing erections, but they do require surgical implantation and carry potential risks and complications.
Okay, so it sounds like understanding the complexities of penile enhancements is crucial before making any decisions.
Absolutely. And consulting with a urologist or a men's health specialist is always recommended. They can provide personalized information and help you weigh the potential benefits and risks associated with each option.
Right, it's about making an informed decision.
Exactly. And remember, a fulfilling and satisfying sex life goes far beyond just physical attributes.
That's a good point.
Open communication, intimacy, emotional connection, and mutual respect are all fundamental elements of a healthy and enjoyable sexual relationship.
Yeah, I agree. Those things are so important.
They really are. And focusing on those aspects can significantly contribute to a positive and fulfilling sexual experience for both partners, regardless of penis size or other physical characteristics.
So it's about the whole package.
Exactly.
Now, if someone's struggling with those aspects of their relationship, Are there resources available to help?
Absolutely. Seeking professional guidance from therapists or counselors who specialize in sexual health can provide valuable support and insights for individuals and couples who are, navigating these aspects of their relationship.
That's good to know. So to wrap things up, what's the most important takeaway you want listeners to remember about sexual and urological health?
Well, sexuality is a multifaceted and personal aspect of human experience. What matters most is finding what feels right for you and your partner. It's about fostering a connection that's based on mutual understanding, respect, and open communication.
I think that's a great message.
And if you have any concerns about any aspect of your sexual or urological health, don't hesitate to reach out to a healthcare professional. They can provide personalized advice, address your concerns, and guide you toward appropriate resources and treatment options.
That's really important. Taking proactive steps to understand and manage your health can empower you to make informed decisions and live a healthier and more fulfilling life.
And for those seeking more information on men's health, be sure to subscribe to yourhealthfacts.com.
It's a great resource for anyone looking to learn more about these topics. Well, that brings us to the end of our deep dive on men's sexual and urological health. We've covered a lot of ground today, but I hope this discussion has been informative and helpful.
Yeah, I hope so too. It's been a pleasure.
It's been great having you here to share your expertise. And to our listeners, thank you for joining us today on Your Health Facts podcast. We encourage you to continue the conversation and prioritize your health and well-being. Remember, knowledge is power, and taking care of yourself is one of the best investments you can make.
Couldn't agree more.
Till next time, stay healthy and stay informed.